Most people know smoking damages your lungs and heart. But what if I told you it's hurting almost every part of your body, even the ones you'd never expect? From your skin to your brain, and even your future children. Smoking leaves a bigger mark than you think. Stick around, because in the next few minutes, we'll uncover the shocking hidden effects of smoking, and why quitting could change everything. Let's start with the basics. Smoking isn't just a bad habit. It's one of the biggest threats to your health worldwide. Every single day, millions of people of all ages light up, from teenagers trying it for the first time to adults who've smoked for years. But here's the hard truth. Smoking remains one of the leading causes of serious illness and death around the globe. When you smoke, you're not just inhaling harmless air. Tobacco smoke contains thousands of harmful chemicals, many of them toxic, and dozens known to cause cancer. And it's not just one type of tobacco that puts you at risk. There are many different forms of tobacco. Cigarettes, the most common and dangerous. Pipes and cigars, which are often wrongly believed to be safer, but they're not. Chewing tobacco, which doesn't have smoke, but still delivers harmful chemicals directly into your mouth and bloodstream. E-cigarettes and vapes, often marketed as better options, but they still expose you to addictive nicotine and other toxins. And loose tobacco and hookah, which can be just as harmful, or even worse depending on how they're used. No matter what form it takes, tobacco is toxic. There's no safe way to smoke. And the damage doesn't just stop at your lungs or heart. It affects your entire body. So as we move forward, we're going to break down exactly what smoking does to different parts of your body, and why quitting could be one of the most powerful health decisions you'll ever make. When you light a cigarette, it may look like you're just inhaling smoke. But in reality, you're breathing in a toxic cocktail of dangerous chemicals. And each puff is doing far more harm than most people realize. Let's break down a few of the most dangerous substances hiding inside that smoke. First, nicotine. This is the chemical that hooks you. Nicotine is incredibly addictive. In fact, it can rewire your brain to crave more and more, making it extremely hard to quit. It doesn't just affect your lungs, it impacts your mood, your focus, and your entire nervous system. Next is carbon monoxide. Yes, the same deadly gas that comes out of car exhaust. When you smoke, this poison goes straight into your bloodstream, pushing out the oxygen your body needs. Over time, this starves your organs and puts massive stress on your heart and brain. Then there's tar. Think of it like a sticky black coating that clings to your lungs. Tar is packed with cancer-causing chemicals. It damages the delicate lining of your airways, making every breath harder and increasing the risk of lung disease and cancer. And finally, lead and other toxins. These poisonous substances can damage your organs, weaken your immune system, and harm your body at the cellular level. Over time, they can contribute to everything from heart disease to reproductive problems. Here's the reality. There's no safe amount of these chemicals. Every cigarette you smoke delivers this toxic mix straight into your body. And the longer you smoke, the more damage builds up. But the good news is, once you quit, your body starts to fight back. It begins to repair, your oxygen levels improve, and your risk of disease slowly goes down. So quitting isn't just a choice, it's giving your body a second chance at life. Here's something a lot of people don't realize. The damage from smoking isn't the same for everyone. It depends on how much you smoke, what you smoke, and what's inside every puff. Let's start with the amount. The more you smoke, and the longer you've been smoking, the more your body absorbs those toxic chemicals. It's like adding layers of damage over time. One cigarette may seem small, But over weeks, months, and years, it builds up and quietly eats away at your health. Next is the type of tobacco. Cigarettes, cigars, hookah, vaping. They all come with their own risks. Some people think switching to a different type of tobacco makes it safer, but here's the truth, it doesn't. No matter the form, you're still inhaling harmful substances that can damage your lungs, heart, and other organs. Then there's how it's prepared and what it contains. Some products have extra chemicals to make them burn faster or taste smoother. But those additives only make the smoke more dangerous. You're not just inhaling tobacco. You're inhaling a mix of toxins designed to keep you addicted. The bottom line, the more you smoke, and the more toxic the product, the faster and deeper the damage goes. It's not just about one cigarette. It's about the daily impact that adds up over time. But here's the good news. No matter how long you've smoked, quitting can stop the damage from getting worse. And your body can start healing. Every cigarette you don't smoke is a win. When most people think about smoking, they picture damage to the lungs or maybe the heart. But the truth is, smoking harms every single part of the body, from your brain to your skin, your bones, your immune system, even your reproductive health. No organ escapes the impact. Let's start with the lungs and heart, because they take the hardest hit. Your lungs are your body's air supply, and every puff of smoke fills them with poisons, making it harder to breathe and increasing the risk of diseases like bronchitis, emphysema, and lung cancer. Your heart works around the clock to keep you alive. Smoking forces it to work even harder, increasing blood pressure, thickening your arteries, and raising your risk of heart attacks and stroke, even if you're young and otherwise healthy. But the damage doesn't stop there. Long-term smoking quietly raises your risk for dozens of chronic diseases, cancers, diabetes, immune system problems, and more. It also takes years off your life. In fact, many smokers die earlier than non-smokers, not because of one big event, but because of the daily, silent damage that builds over time. The scariest part, you don't have to be a heavy smoker to be at risk. Even a few cigarettes a day can hurt your body in ways you might not notice until it's too late. But here's the good news. Once you quit, your body doesn't give up on you. Your heart rate and blood pressure start to drop within minutes. Your lungs begin to clear out toxins. And your risk of serious disease slowly drops with every smoke-free day. Smoking doesn't just affect how long you live. It affects how well you live. And quitting gives you the chance to take your health back. Let's talk about some real facts about smoking. The kind most people don't think about until it's too late. Smoking doesn't just affect your lungs or heart. It's harmful to your entire body, from the inside out. Every puff you take carries thousands of chemicals that move through your bloodstream, touching every organ and tissue. And over time, those chemicals leave behind damage that your body struggles to repair. This is why smoking is linked to many serious illnesses: cancers, lung disease, heart problems, stroke, diabetes mellitus, and more. But the damage doesn't always start with something life-threatening. Sometimes, it begins with the things you see in the mirror. Smoking doesn't just hurt your health. It can change your appearance, too. It speeds up skin aging, causing wrinkles to appear earlier around your mouth and eyes. It stains your teeth and fingers yellow, leaving marks that are hard to remove. It dulls your complexion, giving your skin a tired, pale, or uneven look. And it leaves a persistent bad breath that no amount of mints can fully hide. Every single cigarette does damage, not just to what's inside your body, but to what the world sees on the outside. And that's something people often overlook. But here's the hope. The moment you stop smoking, your body starts to bounce back. Your skin begins to regain its glow. Your breath improves. Your risk of illness starts to drop. Quitting isn't just about living longer. It's about looking better, feeling stronger, and taking back control of your health. When most people think about smoking and cancer, they immediately think about lung cancer. And that's true. Smoking is the #1 cause of lung cancer. But what many don't realize is that it can increase your risk of many other deadly cancers all throughout your body. Every puff of smoke carries thousands of toxic chemicals, and many of them are proven to damage cells and trigger cancer over time. And this damage isn't limited to your lungs. It can happen almost anywhere. Mouth cancer, especially dangerous for people who smoke or chew tobacco. Bladder cancer, toxic substances travel through your blood and collect in your urine. Esophagus cancer, that's the tube connecting your mouth to your stomach. Throat cancer, another common cancer linked to both smoking and chewing tobacco. Kidney and liver cancers, because these organs work overtime trying to filter toxins. Stomach, colon, and rectal cancers, showing that smoking damages your digestive system too. Pancreatic cancer, one of the most aggressive and deadly. Cervical cancer in women, increasing risks even further when combined with other factors. Leukemia, a cancer of the blood, proving smoke doesn't stay in your lungs. It spreads throughout your body. And yes, even skin cancer, because toxic chemicals affect every cell, inside and out. Here's the bottom line. Every puff increases your risk of developing multiple cancers. It doesn't happen overnight. It builds up silently over time. But there's good news. Quitting early can significantly lower these risks. The moment you stop, your body begins to heal. Your cancer risk starts to drop, and your cells get a chance to recover. Smoking is powerful, but so is your decision to quit. The earlier you make that choice, the more years you can protect, and possibly save. Every single breath you take keeps your body alive. Your lungs are your personal life support system, and smoking attacks them with every puff. When you smoke, you're far more likely to develop serious lung problems, and it often starts sooner than you think. Breathing problems and shortness of breath are some of the first warning signs. You may notice getting winded after climbing a few stairs or walking a short distance. Things that once felt easy. That's because smoke slowly damages the tiny air sacs in your lungs that bring oxygen into your blood. Then come lung infections like pneumonia or bronchitis. Smoking weakens the lungs' natural defenses, making it easier for bacteria and viruses to get in and harder for your body to fight them off. What could have been a minor cold can turn into something much more serious. Over time, the damage can lead to chronic lung diseases like COPD or emphysema. These aren't just medical terms. They're life-changing conditions that make it hard to breathe every single day. Many people with COPD struggle just to walk or talk without feeling out of breath. And if you already have asthma, smoking makes it worse. It triggers more frequent flare-ups, longer recovery times, and a higher risk of dangerous complications. Here's why this matters. Your lungs are not replaceable. They're essential for everything you do. Moving, talking, laughing, even sleeping. Smoking weakens them faster than most people realize, and even light smoking can cause real, lasting damage to your lung tissue over time. But here's the powerful part. The moment you quit, your lungs begin to heal. Within weeks, breathing can get easier. Your risk of lung infections drops. Over time, your lung function can actually improve. Quitting isn't just about avoiding disease. It's about giving yourself the ability to live, breathe, and enjoy life to the fullest. Every beat of your heart is a reminder that your body is fighting to keep you alive. But when you smoke, you're not just damaging your lungs. You're putting your heart and entire circulatory system under extreme stress. First, smoking increases your risk of heart disease and stroke, two of the leading causes of death worldwide. The chemicals in tobacco smoke damage the lining of your blood vessels, making it easier for dangerous plaque to build up and harder for your heart to pump efficiently. Smokers are also at a much higher risk of high blood pressure. Think of your blood vessels like flexible tubes. Smoking makes them stiff and narrow, forcing your heart to work overtime to push blood through. That constant strain weakens your heart over time. And that's not all. Blood clots are more likely to form when you smoke. These clots can block critical blood flow to your heart, brain, or other organs in seconds. A single clot can cause a heart attack, a stroke, or worse. Smoking also reduces blood flow to your legs, skin, and other body parts, slowly starving your tissues of oxygen. This is why many smokers experience cold hands and feet, slower healing, and in severe cases, tissue damage that can lead to amputation. Why this matters? Every cigarette forces your heart to work harder than it should. Poor circulation isn't just uncomfortable. It can lead to permanent, life-altering complications. And here's the good news. Your body starts to repair itself fast. When you quit smoking, your blood pressure begins to improve within just weeks, your circulation gets better, and your risk of heart attack and stroke begins to drop. Over time, your heart can actually become stronger. You don't need a perfect heart to quit smoking. You just need to give it a chance to heal. The sooner you quit, the sooner your heart can breathe easier. When people think about smoking, they often picture lung damage or heart disease. But here's something most people don't realize. Smoking can also raise your risk of developing diabetes mellitus, and make it much harder to control if you already have it. If you smoke, your body becomes more resistant to insulin, the hormone that controls your blood sugar. This means your sugar levels can creep higher and stay high, even if you're trying to live a healthy lifestyle. That alone raises your risk of developing type 2 diabetes mellitus. And if you already have diabetes, smoking makes everything more complicated. High blood sugar combined with the harmful chemicals in tobacco is a dangerous mix. It can make managing your condition much harder, increase the need for medications, and raise your risk of serious health problems. Why this matters? Smoking doesn't just make your blood sugar harder to control. It can lead to nerve damage, which can cause numbness or pain in your hands and feet. It increases your chances of kidney disease, putting extra strain on your body. And it raises your risk of heart problems, which people with diabetes mellitus are already more vulnerable to. But here's the hopeful part. Quitting smoking can help stabilize your blood sugar. Your circulation improves, your body responds better to insulin, and your risk of complications begins to drop almost immediately. Quitting isn't just about breathing easier. It's about protecting your nerves, your organs, and your future. If you have diabetes mellitus, or want to prevent it, quitting smoking is one of the most powerful steps you can take to stay healthy. When we talk about smoking, most people think about lungs, heart, or maybe cancer. But what often gets ignored is how smoking silently attacks your digestive system, the very system your body depends on to process food, absorb nutrients, and keep you energized. Smoking makes your stomach produce more acid than it should. Over time, this extra acid can eat away at the protective lining of your stomach and intestines, creating painful sores or ulcers. These aren't just uncomfortable. They can lead to bleeding, infections, and serious complications if untreated. That extra acid can also flow back up into your esophagus, causing heartburn. That burning, uncomfortable sensation in your chest. And for many smokers, this happens regularly, turning meals into a source of pain instead of comfort. On top of that, smoking increases your risk of bowel irritation and inflammation. This can mean cramping, bloating, changes in your digestion, and even chronic gut problems over time. Why this matters? Your digestive system is the engine that fuels everything else in your body. Smoking weakens it slowly, leading to chronic pain, discomfort, and long-term stomach problems that don't just go away on their own. But here's the good news. Your gut can heal. When you quit smoking, acid levels begin to normalize, ulcers can start to heal, and your digestion works more smoothly. Many people notice less heartburn, less bloating, and more energy just weeks after quitting. Quitting isn't just about protecting your lungs or heart. It's about giving your entire body, including your digestive system, the chance to recover, rebuild, and thrive. When we think about the effects of smoking, we usually picture lungs, heart, or maybe cancer. But what almost no one talks about is how smoking weakens your bones from the inside out. Your bones might seem solid and unbreakable, but smoking quietly makes them fragile over time. If you smoke, your bone-forming cells actually grow slower. This means your bones can't rebuild and stay strong the way they're supposed to. It's like slowly chipping away at the foundation of a building. Eventually, cracks start to show. Weaker bones increase your risk of osteoporosis, a disease that makes bones thin, brittle, and much easier to break. This isn't just a concern for older adults. Smoking speeds up bone loss at any age. Many smokers also experience more low back pain and arthritis, as weaker bones and joints struggle to support everyday movement. There's also a higher risk of overuse injuries, especially for people who play sports or do physical work. Bones and joints just don't recover as quickly, and when breaks do happen, they're more likely in smokers, and they take longer to heal. A broken bone that might heal in weeks for someone else can take months for a smoker, sometimes leading to lasting pain or disability. Why this matters? Weaker bones don't just mean more fractures. It means less strength, more pain, and longer recovery from even simple injuries. But here's the powerful part. Quitting smoking can help rebuild your strength. Once you stop, your bone-forming cells can recover, your bone density can stabilize, and your body can begin to heal. The earlier you quit, the more strength you protect for the future. You only get one skeleton. Make it strong enough to carry you through a long, healthy life. When you're pregnant, every choice you make affects not just you, but your baby. And smoking during pregnancy is one of the most dangerous choices a mother can make, often without realizing just how deep the damage can go. Cigarettes don't just fill your lungs with harmful chemicals. They pass through your bloodstream, reaching your baby within seconds. And because babies are still developing, those toxins can cause life-changing harm. Smoking during pregnancy greatly increases the risk of premature birth, meaning your baby may be born too early. Premature babies can face breathing problems, developmental delays, and may spend weeks, even months, in the hospital fighting to grow strong. It also raises the risk of sudden infant death syndrome, or SIDS, a terrifying tragedy where a seemingly healthy baby dies unexpectedly during sleep. There's also a higher chance of stillbirth, when a baby is born without life. This is one of the most devastating outcomes any parent can face. Babies born to mothers who smoke often have low birth weight, which makes them more fragile, more prone to infections, and more likely to face health problems throughout their lives. Smoking also increases the risk of ectopic pregnancy, where the pregnancy develops outside the uterus. This can be life-threatening to the mother and cannot result in a healthy baby. And even if the baby is carried to term, there's a higher risk of birth defects, including mouth and facial deformities, and lifelong health problems that could have been prevented. Why this matters? Smoking doesn't just affect the mother, it affects the baby's future. Even a few cigarettes can increase the risks. But here's the hope. The moment you quit, your baby's health starts to improve. Quitting smoking during pregnancy lowers the risk of complications, strengthens your baby's growth, and gives them the best chance at a healthy start. Quitting isn't easy, but when you do it for your baby, it's one of the most powerful gifts you can ever give. A smoke-free pregnancy means a safer birth, a healthier child, and a stronger future. When people talk about smoking, they usually focus on what it does inside your body, your lungs, your heart, your organs. But here's the truth most people ignore. Smoking shows up on the outside too. In your face, your hair, your hands, even your smile. And it can happen much faster than you think. Smoking can make your eyes cloudy and increase your risk of cataracts, which can blur or even block your vision over time. That means trouble seeing clearly, years earlier than most people. Your hair may thin and turn gray earlier, because smoking weakens hair follicles and cuts off the nutrients they need. This isn't just about vanity, it's about your body aging before its time. Look down at your hands. Smoking stains your fingernails, turning them yellow and brittle. These are small but visible signs that tell the world you smoke, even if you try to hide it. Your teeth take a big hit too. Over time, they turn yellowish-brown and stained. And it's not just cosmetic. Your gums weaken, making your teeth loose and increasing your risk of gum disease, tooth loss, and expensive dental treatments. Your sense of taste and smell slowly fades away. Foods you used to enjoy won't taste the same, and fresh air won't smell as fresh anymore. And let's not forget the bad breath. Smoke clings to your mouth, throat, and lungs. So even after brushing or chewing gum, that smell doesn't fully go away. Why this matters? Smoking doesn't just damage your health, it ages you faster. It dulls your appearance, weakens your confidence, and makes your body look older than your years. But here's the good news. Quitting can help reverse some of that damage. Your taste and smell can return. Your gums can get healthier. Your skin, hair, and nails can slowly regain their natural color and strength. And most importantly, your confidence grows when smoking no longer controls your life. Smoking steals your health and your glow. Quitting gives both back. Your skin tells your story. It's the first thing people see, and often the first place where the damage from smoking becomes visible. You might not notice it after a few cigarettes, but over time, the signs become impossible to hide. Smoking reduces blood flow to your skin, starving it of oxygen and nutrients. This means your skin can't repair itself as well, and every puff slows down the natural renewal process that keeps it healthy and glowing. One of the earliest signs. Wrinkles. Fine lines start forming earlier around the eyes and mouth because smoking breaks down collagen, the protein that keeps your skin firm and smooth. What should show up in your 50s can start appearing in your 30s, or even sooner. Your skin also becomes dry and dull. Without enough circulation, it loses its natural moisture and healthy tone. Over time, your skin loses its elasticity and strength, making it sag more quickly. Many smokers notice their skin turning pale or splotchy, as if the glow has faded away. And then there's what dermatologists call smoker's face. A thinner, aged, tired-looking face that develops faster in smokers than in non-smokers. As if that's not enough, smoking also raises your risk of psoriasis, a painful skin condition that can cause itching, burning, and visible patches on your body. Why this matters? Smoking doesn't just harm what's inside. It ages you on the outside faster than almost anything else. In fact, your skin often shows the damage long before other parts of your body do. But here's the good news. Your skin has an incredible ability to heal. When you quit smoking, blood flow improves, oxygen returns, and your skin begins to regain its glow. Wrinkles may soften, color returns, and that tired look slowly fades. Quitting isn't just about living longer. It's about looking healthier, feeling more confident, and reclaiming your natural glow. When most people think about smoking, they picture lungs and heart problems. But here's something many don't realize. Smoking can quietly and seriously damage your sex life and reproductive health. First, let's talk about men. Smoking affects blood flow, and when blood can't flow properly, it can lead to impotence and erectile dysfunction. Even young men who smoke regularly may notice difficulty getting or keeping an erection. This isn't just a problem for older smokers. It can start much earlier than you might expect. For both men and women, smoking can make getting pregnant harder. Nicotine and other toxins in cigarettes interfere with hormones, damage reproductive cells, and reduce fertility. For women, smoking can trigger early menopause, meaning your body stops producing eggs sooner than it should. That not only impacts fertility but can also bring on uncomfortable symptoms like hot flashes, mood changes, and low energy. Warning, and here's a serious warning. Women who smoke and use birth control pills have a much higher risk of heart attack and stroke. It's a dangerous combination that can have life-changing consequences. Smoking also damages sperm. That means even if pregnancy does happen, the chances of birth defects, miscarriage, or fertility complications rise dramatically. It affects not just the smoker, but future generations too. Why this matters? Smoking doesn't just harm your body. It impacts your intimacy, your relationships, your ability to have children, and your future family's health. The good news: when you quit smoking, blood flow improves, fertility can recover, and overall sexual health gets stronger. Many people notice positive changes in their energy, desire, and confidence within just weeks of quitting. Don't let cigarettes control your love life or your future. Your body can heal, and it starts the moment you quit. When people talk about smoking, they usually focus on the damage it does to the body. But here's the truth most people don't hear often enough. Smoking can change the way your brain works and how you feel every single day. First, let's talk about mood. Nicotine gives you a quick rush, but that feeling doesn't last long. When the nicotine wears off, your brain starts to crave more. And that's when irritability, anxiety, and restlessness kick in. It's not just a habit. It's a cycle your brain gets trapped in. Over time, smoking creates a powerful addiction. Nicotine hijacks the brain's reward system, the same system that controls pleasure, motivation, and focus. That's why quitting can feel so hard. Your brain has been trained to believe it needs that next cigarette just to feel normal. And here's something even more serious. Long-term smoking can damage brain cells and interfere with clear thinking. Many smokers report feeling foggy, forgetful, or confused over time, especially as the brain's oxygen supply decreases. On top of that, Smoking can increase the risk of depression and low mood. Research shows that nicotine changes brain chemistry in a way that can make negative emotions feel more intense and harder to shake. Why this matters? Smoking isn't just affecting your lungs or your heart. It's shaping your emotions, your focus, and your mental health. The addiction keeps you stuck in a loop that can chip away at your energy, your clarity, and your confidence. But here's the good news. The brain can heal and rewire itself. When you quit smoking, your mood can stabilize, your mental clarity improves, and the cravings start to weaken over time. Every cigarette keeps your brain locked in a cycle, but quitting breaks that chain. Your mind becomes clearer, stronger, and more in control. When you smoke, it's not just your health on the line. It's your children's health and future, too. Whether you light up at home, in the car, or even outside, your choices can have lasting effects on the little ones who look up to you. Children who grow up around smoking are far more likely to start smoking themselves. It's not just what you say that matters. It's what they see. Kids watch everything. If smoking seems normal to them, they're more likely to copy that behavior when they're older. And even if they don't smoke, secondhand smoke can make them sick. This invisible danger lingers in the air, on furniture, clothing, and even your hair. It can trigger asthma attacks, ear infections, breathing problems, and increase their risk of heart disease later in life. Young lungs are still developing, and smoke can damage them quickly. Here's a fact many people don't know. Most smokers start before the age of 18. That means the best time to prevent addiction is during childhood. Kids need to learn early about the real dangers of smoking. Not from strangers, but from the people they trust most, their parents and caregivers. So talk to your children openly. Encourage them never to smoke. Remind them why health matters. And most importantly, show them by example. Quitting smoking is one of the most powerful lessons you can give your child. It tells them their future matters. Why this matters? Secondhand smoke doesn't just hurt your child's lungs and heart today. It can shape their health for years to come. Your decision to quit smoking can protect them, inspire them, and possibly save their life. You're not just quitting for yourself. You're quitting for them. When we think of smoking, most of us picture blackened lungs or a weakened heart. But the truth is, the damage doesn't stop there. Smoking affects nearly every part of your body, even in ways most people don't realize. First, smoking slows down your body's healing. Whether it's a small cut or a major surgery, wounds take longer to close, and your body struggles to fight off infection. That means longer recovery times and higher chances of complications. Poor appetite is another hidden consequence. Nicotine can suppress hunger, leading to unhealthy weight loss and less energy. Many smokers don't notice this until fatigue or weakness sets in. Smoking also triggers inflammation throughout your body, while weakening your immune system at the same time. This double hit makes it harder for your body to defend itself, and easier for illness to take hold. Over time, smoking increases your risk of rheumatoid arthritis, joint pain, and injuries. Your bones and joints pay the price for every puff. It also makes your body more vulnerable to HPV-related warts and infections, because your immune system isn't at full strength. And let's not forget something everyone around you can sense: that persistent smoke odor. It sticks to your hair, your clothes, your breath, and even the furniture in your home. Smoking doesn't just affect how you look or smell, it affects how you perform. Reduced oxygen in your blood means your stamina drops, your endurance weakens, and even simple physical activities can feel harder. And then there's the financial cost. A single pack of cigarettes a day in the US can cost more than $2,000 every year. That's money literally burned away. On top of that, smoking leads to higher healthcare costs, more missed work, and long-term medical bills that can add up fast. Even your hearing can be affected. Over time, smoking reduces blood flow to the inner ear, increasing the risk of hearing loss. But here's the part that matters most. There is hope. It's never too late to quit. The moment you stop smoking, your body begins to heal. Your circulation improves. Your breathing gets stronger. Your risk of serious diseases starts to drop. And over time, your energy, taste, smell, and appearance can rebound. Quitting isn't just about adding years to your life. It's about bringing life back to your years. Your future self will thank you. If you're ready to quit smoking, first of all, you're already taking the most important step. Quitting isn't easy, but it is possible, and millions of people have done it. You can too. The first step, set a quit date. Don't just say, someday. Pick a specific day and commit to it. Treat it like a promise to yourself. Next, figure out your triggers. When do you usually reach for a cigarette? After meals. When you're stressed, bored. Once you identify what sparks the craving, you can plan how to handle it differently. Remind yourself why you want to quit. Maybe it's your health, your kids, your future, or simply to feel free again. Write it down. Look at it when cravings hit. Your why is your power. Start tracking every cigarette. Note the time, where you are, and what you're doing. This makes patterns visible. And once you see them, you can plan what to do instead. Swap smoking for a walk, a drink of water, deep breaths, or talking to someone you trust. Tell your family and friends about your quit plan. Ask for their support. Whether that means cheering you on, holding you accountable, or just listening when it gets hard. If quitting cold turkey feels overwhelming, you can gradually reduce your smoking. Every cigarette not smoked is a small win. Make your environment work for you. Remove all tobacco products from your home, car, and workplace. Clear out ashtrays and lighters. When smoking isn't easily within reach, resisting temptation becomes easier. Avoid places or situations where you'll be tempted to smoke. And if people close to you smoke, ask them not to smoke around you. Or even better, quit with you. Quitting together can make the journey less lonely. Reward yourself for your progress. Celebrate milestones. 1 day, 1 week, 1 month. But skip food rewards. Treat yourself with something that makes you feel good. Like a new book, a movie, or something you've been saving for. And don't forget, you don't have to do this alone. Ask your doctor for help, guidance, and resources. There are nicotine replacement therapies, medications, and support groups that can make the process easier and more effective. Thinking about e-cigarettes? Talk to your doctor first. They're not a guaranteed safe solution, and quitting altogether is the best goal. And finally, remember this. Quitting is a journey, not a race. You don't have to be perfect. What matters is that you keep going. Every single day you don't smoke is a victory. Your lungs begin to heal, your heart gets stronger, your energy rises, and your future grows brighter. If you've ever doubted your strength, let this be your reminder. You are capable of change. And your future self will thank you for every step you take today. When it comes to quitting smoking, or understanding the real risks, information is your greatest weapon. The more you know, the better equipped you are to protect your health and take control of your future. Start with the Centers for Disease Control and Prevention, or CDC. They offer trusted, science-based information on the health effects of smoking and practical tools to help you build a quit plan that actually works. You can explore real stories, step-by-step quitting tips, and proven strategies that have helped millions. If you're a teen, a parent, or want to guide young people, Kids Health is another great resource. It explains smoking's dangers in simple, easy-to-understand language, making it perfect for kids, teens, and families. Early education can stop lifelong habits before they even start. And don't forget the U.S. Food and Drug Administration, the FDA. They provide detailed information on tobacco products, ingredients, and how these chemicals affect your body. When you understand exactly what's inside a cigarette and how it impacts your health, quitting becomes not just a goal, but a priority. Here's an important tip. Always use trusted health websites like these. Don't rely on myths, rumors, or random advice online. The truth matters, and it can make or break your quit journey. Knowledge is power. Every fact you learn arms you with the strength to make better choices for yourself and for the people who love you. When you're ready to quit, these resources can be your map, your guide, and your support system every step of the way. We've uncovered something important today. Smoking isn't just about lungs, or heart disease, or a cough that won't go away. It's about every part of your body, your mind, and even the people you love most. Every cigarette doesn't just take a moment. It takes away strength, energy, time, and opportunities. But here's the good news. You can take all of that back. When you decide to quit, your body begins to heal within minutes. Your lungs start clearing out, your heart gets stronger, your skin glows again, and your future opens up. Whether this is your first step or your 10th, it's never too late to take control. You're not weak for struggling. You're strong for trying. If this video opened your eyes or reminded you why health matters, don't keep it to yourself. Share it with someone who needs to hear this. It could change, or even save, a life. And if you found this helpful, hit that like button, subscribe for more powerful health stories, and turn on notifications so you don't miss the next one. Drop a comment below and tell us, what's your why for quitting? You never know who your story might inspire. Remember, your future is bigger, brighter, and stronger than a cigarette. And the best time to start your comeback story is now.